Greetings, everyone. Dr. Frank here with a protocol update. I'm very proud to announce that we're going to be starting a Leave Behind Naloxone program here in Sarasota County. We've been working on this for over a year, and we're finally getting this off the ground. So this is the Leave Behind Narcan kit, and we get this through a program called HEROES program, which is through the state. They fund us with Narcan, and we are going to start leaving it behind in patients' homes. One thing that's important to understand, there may be some of you out there that are skeptical of programs like this, and it's important to understand that there's no literature to support that programs like Leave Behind Naloxone or needle exchange programs or any other public health programs like this increase the use of opioids or other drugs. So somebody may say, you know, people feel safe at home to use this or to have this at home and use opioids. There's no literature to support that that's the case. In fact, there's literature to support that that's not the case. So this does not increase opioid use. What it does is decrease the opioid death. So, you know, if it takes us 3 or 4 or 5 minutes to get to an opioid overdose, that patient's hypoxic, apneic for that period of time, we can stop cardiac arrest from occurring from opioid overdose by empowering the public and the people at home to administer Narcan to their friends or loved ones. So when are you going to use this? It's really, it's sort of a gray area. I can't really say exactly when you're going to leave it behind, but for sure there's times where you will, or at least offer it. For example, we show up on the scene of a call, we reverse an opioid overdose, and we take the patient to the hospital. A friend or a family member or a roommate that stays on the scene, we're going to offer that Narcan or that naloxone to that friend or family member or to the patient and say, we're going to leave this with your friend or your family member. Is that okay? You know, and then we'll instruct the friend or family member on how to use it, and I'll go over that in a minute. So that's one example. Another example is that if we reverse the opioid overdose or law enforcement reverses it and we show up and the patient's awake and alert and has capacity to make decisions, he understands risks, benefits, alternatives to treatment and transport, and we've determined that he has capacity, that patient potentially can refuse further treatment and transport. So what you'll do is you'll activate the on-call online medical command system. You'll either speak with one of the captains or with me, and we'll together ensure that the patient has capacity, and then that patient, if appropriate, will sign a refusal. And in that situation, it's a good idea to offer the patient a Leave Behind Narcan kit, especially if there's a friend or a family member who's there who can watch the patient and say he develops signs of opioid overdose again, because maybe the opioid has a longer half-life than the Narcan does, and then that person can administer the Narcan to the patient and then call 911 again. So there's going to be times where it's very obvious where we want to leave it. There's going to be times where it's not so obvious, and you may offer the patient or the family members a Leave Behind Naloxone kit. So we'll leave it. There's some discretion to be left there, but for sure the examples that I just gave should be included. So when we leave it, there's going to be the Narcan kit, which comes with 2 4-milligram intranasal Narcan doses. And there's going to be some information about local resources as well. But what would be best for us to do is to explain to the patient or the family member or the roommate or the loved one how to use it. And on the box, there's a little pamphlet that opens up. This is not opening the drug itself. This is just a little flap that opens up, and it shows us exactly how to use the medicine. Okay, so it would be beneficial if we can just go over that with the person we're leaving it with, close it back up, it closes up, and then you leave it with them. And then, like I said, there's going to be a pamphlet with resources and so forth. And then also explain to them, signs and symptoms of opioid overdose, when to administer it, and so forth. So again, I'm very proud and happy to be able to start this program. We've been working on it for a while. I think it's going to reduce the amount of opioid overdose deaths that we see, which is obviously what we're trying to do. One final thing to remember is that in Image Trend, there will be an area that we'll be able to document that we left behind Narcan. So we're going to be able to track how much we're giving. That's the only thing we're tracking. We're not tracking who we're giving it to or where we're giving it. It's just that we need to know how much we're using and be able to report to the state that we need more. So please remember to pull that down from Image Trend that you left behind Narcan, so we can know how much we're using and when we need to get more. If you have any questions, please reach out to your captains and we can address them. And thank you very much.